My name is Dr. Senthil Rajappa. I work as head of the department and senior consultant in medical oncology at the Basavatarakam Indo-American Cancer Hospital. We are here today to talk about breast cancer and increase the awareness about breast cancer among the public, especially women. Breast cancer is a very common malignancy that occurs in the population. Breast cancer can affect women and men, although it's less common in men compared to women. In India, in the urban cancer registries, breast cancer is the most common cancer in women. In the rural cancer registries, it's cancer of the cervix, which is much more common than breast. If you look at the incidence in this country, it is lesser compared to the West, but however, we have about 20 to 30 per 100,000 women who have breast cancer in this country. So approximately it would be about 2 to 250,000 new breast cancer cases in this country every year. So it is a problem that is progressively increasing every year, and we see more women are diagnosed, more women are coming forward with complaints with regard to the breast. We are making this diagnosis more often. We are getting this disease out much more earlier than what we used to do. Detecting this disease in the pre-cancerous stage or in the earliest stages of the cancer is of paramount importance, because if you detect it early or in the pre-cancerous stage, you can get away with doing very simple, cheap, highly efficient treatments which don't have any side effects at all and get 100% cure rates in this disease. So it is extremely important to be aware of this disease and seek medical help as early as possible. The biggest risk factor for breast cancer is being born a lady. If you have a breast, then that's the greatest risk factor. There is no age in which you cannot get this disease. Generally, the disease peaks between the ages of 45 and 50. The youngest breast cancer patient that at least we have seen is about 16 years of age, and the oldest is about 100 years old. So anybody is not immune to this disease and no age is spared. There are many symptoms that should raise the suspicion of this disease. The most common symptom of breast cancer is to have a lump in the breast. This lump is generally painless, contrary to what patients come and tell us, that they didn't have pain and hence they didn't have a suspicion of breast cancer. It's important to remember that most malignant lumps are not painful at all. The other things that one should notice is any change in the skin of the breast, any darkening, any reddishness of the skin of the breast can be an early sign of breast cancer. Indrawing of the skin from the surface can be an early sign. Any change in the size of the nipple, one side compared to other, the change in the shape of the nipple compared to the other side, or any discharge from the nipple, which may be clear serous discharge or a bloody discharge, can be a sign of breast cancer. It is also important to remember that any problem that arises in the armpit, for example, a painless swelling in the armpit that is progressively increasing in size, may also be a sign of breast cancer or cancer which is spread to the armpits from the breast. So all of these signs should alert somebody that they may be having breast cancer. Apart from this, the disease can also manifest as cough, breathlessness when the disease spreads to the lung, or bone pains when it spreads to the bone, and depending on wherever it spreads, you can have symptoms pertaining to that particular system. One is whether there are any treatments. The second is whether we're doing any research. Absolutely yes, there are many treatments and this disease is curable today as long as it's detected early. So it's extremely important to pick it up early, because if you pick it up in stage 1, then the chance of having a cure from this disease is more than 90%, compared to about 20% chance of a cure when you pick it up in stage 4 disease. For stage 2 disease, it's between 70 and 80%. For stage 3 disease, it's about 50%.